Hello, everyone. Welcome to another new episode of the Digital Dentistry Deep Dive podcast, uh, where we talk about tools, trends, and technology that's shaping up the clear aligner industry and dentistry in general. Today is a very special day. We have a very special guest with us from across the Atlantic. We have Sarah Sharfstein from Aspen Dental. Sarah is the Vice President of Commercialization with Aspen Dental. She had also been the Vice President of Category Development and Strategy that launched Motto Clear Aligners. She also is the founding board member of Women in DSO, and you also had a long 12-year career with Align Tech, where you were the director of marketing and education for Americas. That's a very good, nice CV there. Sarah, welcome to the podcast.
Thank you. Thanks for having me.
So, Sarah, let's go into the questions. The first thing, because we kind of looked at your long career where you had different leadership positions. So, I think the first question is that what made you join Aspen Dental when you were at a very leading position, and where you had a position which was making a change globally in how the clear aligner industry is perceived, being at Align Tech. So, what made you join Aspen Dental?
Yeah, so I've been at Aspen for the last 5 years, and it was really a tough decision. I loved my time at Align. I had a tremendous amount of opportunity and felt like I was really able to create change and deliver value. But when I thought about making a change, I knew I wanted to stay in the dental space, and I knew I wanted to be with a consumer-centric, retail-oriented organization, somebody with a brand. And so when you think about 5 years ago, the two fastest growing things in dentistry were really DSOs and clear aligners. And so to join an organization like Aspen with more than 11,000 branded practices across the US, Class A real estate and strong brand equity, it was sort of a no-brainer to join Aspen. And then naturally to have the opportunity to launch digital scanning along with clear aligners across the organization felt like the right next step within my career, if I wanted to stay in dental.
Great. No, thanks. And just coming into now, while you were there at Aspen, how and why did such a big DSO brand would launch their own aligner brand? Like, what was the thought process inside the company? And can you also walk us through the different stages when when you're at the ideation stage? What all went through with all the chaos, and usually with all the new product launches. And so, can you walk us through the thought process first, and the whole process of launching your own aligner brand, which is a very mammoth task for such a big organization?
Yeah, I mean, it was a really great opportunity. When I joined the organization, we launched digital scanning along with Invisalign, and I think we had a really good partnership with Align, and I think both organizations really delivered on their commitments. As we spent more time in the clear aligner space, I think we recognized that there was a tremendous opportunity. You've got Invisalign on one end of the spectrum, great product, great brand, but inconsistencies in operations across the board, right? So you distribute Invisalign through 40,000 plus providers. And so there's variations across the board as it relates to operating hours. Does this practice accept insurance? Do they offer financing? What is the price point? Do they have extended hours? So you had somebody like a Smile Direct Club or other direct-to-consumer clear aligner brands come in and really provide an alternate solution that standardized things like financing, transparency and price point, aim to drive a more convenient experience for consumers. But in doing that, they really cut a lot of the doctor portion out. So while doctors included in some portions, it's really not doctor directed care. You don't have a doctor with you every step of the way. And so based on our scale, we believe that there was an opportunity to really be the best of both worlds for consumers. So to drive a consistent price that's sort of 50% off some of the name brands out there. We thought there was an opportunity to drive consistency as it relates to pricing, financing options, accepting all insurances. You look at a lot of dental practices on average, I think it's more than 20 days to get a new patient appointment. We guarantee that these patients can walk in, get started today. So we really felt like there was an opportunity to improve the experience, which has really been at the core of who we are as the brand across Aspen Dental with everything we do, whether it's dentures, implants, but it's really how do we bring better care to more individuals and really democratize the care that we're bringing.
And do you see that as a trend across all the other kind of DSOs, or like other people are adopting because you were the first ones, I would say, or the biggest player who would launch their own aligner brand? Is that your trend that you're seeing after you launch model? Like, how's the other world reacted to it?
Yeah, I mean, I think people are curious. Certainly get a lot of phone calls around why we went in that direction, what we're doing, why we believe we'd be able to be successful in that arena. I don't know that other people are looking to necessarily create their own brand, but I think everybody in this space is always striving to improve the consumer experience, remove friction for patients to say yes to care, and certainly remove friction for our doctors to deliver it. So I think everybody's looking to make things more convenient, more accessible, create value-oriented products and services for patients. I think that's sort of the goal of all of us. I think just based on our scale and sort of our network of practices, I think we've been able to do that extremely well, which has actually enabled us to go into other healthcare verticals as well and sort of pick up that operating playbook and transition or transfer that to other brands.
Good, great. And just walk me through, how was the process like, right? Like when you came in, like was the idea already there, or when you joined, like they were still like, did you bring that idea on board that, there should be your own aligner brand? Like how, like, can you walk us through the process, the product development to the launch? Like how was the process, and how many sleepless nights did you have?
It's been years, and it certainly was not
Yeah.
just me. We have a large team, a lot of collaboration across the organization. I think as we launched our initial clear aligner brand, I think we felt like the organization did a great job rallying around it, educating patients on it, starting patients in Invisalign. I think our biggest hurdle, so to speak, was we wanted to be able to help more patients. We wanted to increase access to care, and we knew that there was a greater opportunity. So for us, that meant directly marketing to consumers, creating a really clear brand proposition, value proposition, and marketing to them. And I think we felt that in order to do that, if we were going to start spending considerable money in marketing a clear aligner brand based on who we are, based on the fact that we do have significant brand equity in the markets we're in, we really felt like we wanted to make that investment in ourselves. And so we were open to certainly white labeling with other companies, but it wasn't necessarily on other people's strategic roadmap. And so we made the decision that we were really going to create our own brand. It's our first branded product within the organization, but we felt like it's an opportunity to create our own brand. Really ensure that we're able to deliver a unique and differentiated consumer experience, and do that at scale, which is, of course, challenging. We've leveraged other technology, and we've certainly partnered closely with other manufacturers across the globe, really, to make this a reality. But our doctors as an organization, our doctors and teams have been really enthusiastic. I think they feel like it's their brand. I think they're proud of it, and they're excited to present it and talk to patients about it.
Yeah, great. And was it tough to kind of you said that this was the first own brand within Aspen? Like, was it tough to kind of you leading that from the front, and like was there a lot of responsibility there with the hopes of all the clinics and the doctors and the management team there that this is the first brand, so you make it right and
Yeah, I mean, I think everything is iterative. I mean, I think
yeah.
anytime you do something really innovative and new to an organization, you're moving the Titanic, right? So we think a lot about, what does it look like to create a brand that consumers would be excited about, that they would want to come into our practices. So are we differentiated enough? Are we creating enough value? Is our pricing model and our packaging the right approach? Then the next piece is really thinking through, if you can deliver the demand, is the supply side ready, right? So you've got, across Aspen, we've got probably 13,000 team members. So when you think about how do you get the organization ready, it's a really close partnership with the operations team, with the learning and development team, with IT, with product. And so really thinking through, what does change management look like? How do you tell this story across the organization? How do you train people? How do you drive accountability? How do you sort of motivate and inspire them to take action, particularly when it's different and it's new? And, I think whenever you launch a new product, there's always hiccups, right? There's always learnings. So how do you get the doctors and teams to really feel that this is a partnership, and everybody's leaning in on learning, optimizing, and continuing to improve both the experience, and the program?
Brilliant, great. And how important was technology as part of an enabler for the launch? I know that I see a lot of, because obviously the theme of this podcast is digital, but also in all the kind of the promotional material about motor clear aligners, and I've seen other interviews that you've done as well. So I've seen a lot of mention about digital and technology. So can you talk about that? And was that discussed in the boardrooms that, technology has to be one of the enablers, or is that something that you brought in? But just trying to understand how much was a buy-in from the senior management team as well.
Yeah, I mean, I think technology in everything we do is a key enabler these days. And so I think, a big part of our brand, when we think about, how we promote ourselves and how we talk to dentists and teams about the opportunity to join Aspen, it's really about providing cutting edge technology, making things as simple and easy as possible so our doctors can really focus on delivering care. So it's about having the best technology at our doctors' fingertips, but it's also about how you integrate that technology. It's not really enough to just say, hey, we're going to purchase this scanner or we're going to leverage this 3D printer, but it's really about how do you pull these one-off technologies into a much broader digital ecosystem, and how do you set things up in a way that really removes friction for our doctors to both use the technology but really leverage it for the ultimate, outcome, which is delivering the best clinical outcomes for patients, the best patient experience, and then obviously like efficiencies in the practice. So I think, organizationally, there's always been a commitment to being innovative and being, on the cutting edge of technology. But I would say in the last couple of years, we've really taken it even a step further. And how do we integrate that technology? How do we remove friction? So an example would be prior to launching clear aligners, we do a lot of dentures across the organization. And so when we started, 25 years ago, our founder and CEO, Bob Fontana, started looking at this, saw it as an opportunity and said, okay, what can we do to deliver dentures faster? How can we deliver same day dentures? How can we make the process of dentures easier for our providers? Now we have, on-site labs in every single one of our practices. So a big part of who we are and how we think about the business is really how can we set our providers up for success and how can we make things as easy as possible? And that's, looking at every step really on the consumer journey, and the doctor journey.
Cool. So you mentioned about the journey. I think that was my next question. So you mentioned you used two words, right? One was removing friction, and the other one was on the journey side. So when you were kind of doing or implementing this, obviously I'm assuming there must have been some research done in terms of what were the different touch points where there was friction, because at the end of the day you are improving experience for your providers as well as for the end consumer, which is the patient as well. So what was the process like? And like, in your experience, what were the different frictional points that you saw in the old way of doing things, which I'm assuming the technology or other kind of organizational changes would have resolved? So can you talk about that? Like, what was the process like uncovering those frictional points?
Yeah, I mean, we partner very closely with our doctors, particularly our owners, and then our teams. So I think a big part of it is, really developing what is the consumer journey map? What are all the touch points? How many clicks have to happen here to make something move forward? And, we spend a lot of time in the field, knee to knee with providers and teams. We spend a ton of time talking to the doctors and teams and really getting their very specific feedback, which is amazing. We do a lot of testing, right? So when you think about having an organization with 1,100 plus offices, you're certainly not coming up with an idea and launching it enterprise wide. So we do a lot of, starting with one or two locations and getting their very immediate feedback, spending several days in the practice. Then we'll expand a launch from there, sort of iterating on that feedback, optimizing various systems and processes. So we've got a pretty rigorous what I would consider like testing approach and launch approach. But we really look at our doctors as our partners. So, everything we create is, I think of myself as having two customers, right? One is the end user, which is the patient, and the other customer is the doctor and their teams. And so the feedback they give us on a daily basis is really important in sort of crafting what we're delivering and how we deliver it.
Got it. And I see that, earlier, what I kind of heard from you, what you're saying is that Aspen would have been more of an organized, kind of operational kind of, company. And now it's more like there is a product unit within that as well. So there's a different kind of culture to how an operational unit would behave versus how a product company would behave. So was that a different kind of cultural change, or kind of, was it a lot of training involved in terms of, that this is slightly different in way we do these things, launching a product? As you said, this was a first own brand. So was there a kind of a training or other kind of educational programs that you did company wise? I know you briefly mentioned that, but do you want to elaborate on that? Because it's very interesting.
Sure.
Like, there are two different juggernauts there. Yeah.
Yeah. I mean, I think, I think our organization and brand promise is really about, helping patients get the care that they need and removing barriers to them, getting to yes. And then I would say on the doctor side, we talk a lot about like, we will not let you fail. We are here to support you. We are here to prop you up. We surround you with a team to make you successful, right? And make the teams who you're partnered with successful. So I don't know that any of that's changed, but I think as the organization has continued to evolve and we've grown, we've continued to innovate. We are now tagged the Aspen Group. So in addition to Aspen Dental, we support several different brands and some of which are in a shared services model. Others have unique teams, but I think products are at sort of a core of that. And so there's a variety of different products. Clear aligners, Motto clear aligners might be one of those brands, but there's also digital products, websites, dentures, other places that there's products. And so I think that function within our organization has continued to evolve, particularly as we think about the innovation side of dentistry. We've got digital scanning, you've got CBCTs, digital printing, or 3D printing, excuse me, has become more popular as it relates to dentures, as it relates to surgical guides. People are printing crowns. So I think when you start seeing this disruption in the space, I think you've got to have, a product team that sort of acts as a liaison between operations, marketing, and the IT team to sort of translate consumer insights into a product and something that can actually be developed.
Great. And I know you briefly touched on the kind of the other areas outside of clear aligners as well, and which is your new role. So do you want to talk about, as a VP of commercialization, like what all it involves and how you kind of leverage technology as well within that, the new role that you have?
Yeah, absolutely. So my new role, there's really two areas of focus. One is portfolio strategy. And so that's really thinking through what are the products and services we want to bring to market across the organization? Who are the partners that we want to work with from a technology perspective? What does the innovation roadmap look like? What's our go-to-market plan? How do we stay competitive in market? And so that's sort of the like what we're selling across the organization, what our value proposition is, and what we offer. And then there's another piece to my organization, which I think of as really focused on performance and in-office sort of sales effectiveness. And this is really focused on what is the consumer journey? How do we make sure we're delivering the best experience to patients every single time they walk into our offices that will allow them to get the care that they need? So really focused on yes today. That's everything from what are the various touch points, and then taking it a step further, we know that in order to drive a great patient experience, our doctors and teams have to have a great experience. So when we think about the individuals that are by the side of our patients every single day, are we giving them the best tools and technologies to educate patients in offices? Are we removing friction from the system so that they can get a patient started in care without a lot of hurdles, and make that a seamless process? So those are sort of the two parts. And as you can imagine, I keep saying it, but certainly technology plays a role really in everything we do when you're thinking about scaling in an organization this large, with this many people. Making things simple and easy is really key.
Cool. And what are the three trends that you're seeing? Let's call three trends. I don't want to give you kind of 5 or 10 that you're seeing within the clear aligner space, to be general, like kind of if you want to stick to that kind of industry, like outside of 3D printing, of course, any other thing that you're seeing in terms of that shaping.
I would say, 3D printing, obviously. I would say, I think the introduction of some of the direct-to-consumer organizations have really pushed everybody to streamline the experience, to make things more convenient, more consumer-centric. So I think that's going to continue to be a trend. I think how we leverage technology to take patients through that experience. So there's a variety of new tools out there for patient monitoring, which I think drives, predictability of treatment, efficiency in treatment, a better patient experience. It's more convenient, it's more efficient. I think all of that is really interesting. And then I would also probably say material science. I think as clear aligners have continued to expand and innovate, naturally everybody's waiting, when can clear aligners be 3D printed in a direct manner versus indirect. And so I think that, as the material piece continues to evolve, we'll see more innovation there.
Great. And what's your view on teledentistry?
I think if it expands access to care, I think if it helps patients who otherwise wouldn't have gone to a dentist get the care, get the support that they need, I think it's a great tool. I think it just, it doesn't completely alleviate the need for a dentist. And so I think, when we think organizationally, one of our best assets is really our doctors, our network, our providers. And so I think there's a place for teledentistry, but obviously I don't think it, wipes out the need for having a dentist. And I think dentistry is probably one of the few areas outside of clear aligners that you can really provide care in a remote way.
Yeah, makes sense. Okay, so let's ask a kind of a personal question, like how's a day in the life of Sarah like, right? So right now you must be wearing different hats, personal and professional. So like, how's your typical day like?
Well, I I wish I was a morning workout person. I'm not. But I typically get up and I'm usually on calls pretty early. I start the day by sort of looking at like the schedule, what's the day going to look like, what, fire drills have the potential to occur. I come into the office typically, 3 to 4 days a week. We have a great culture here. We have a huge office in downtown Chicago. We bring a lot of providers, probably 100 plus dentists on a monthly basis through for training. So being a part of the energy here and being live and being able to interact with our providers is, I think, a critical part to all of this. We also do a lot of, dinners in the evenings with providers. It's important for us to spend time with them when they come in. Outside of that, I would say I try to golf when I can. I try to do Pilates when I can. I spend a lot of time with friends and family. But hopefully that gives you, a nutshell of what that looks like.
Cool. Great. Thanks, Sarah. I think thanks for your time. You took time from your busy schedule. I think thanks for, showing up and answering all the questions in a very candid way and sharing your insights. So thanks so much.
My pleasure. Thanks for having me.